Can you try something angle or something where what are you using, laptop or computer?
Laptop, sir.
Laptop. Then laptop can be carried to a computer's mode.
Better light place.
Or the light should fall on your face. For example, I've got two lights here. That's why it is. All of them have got lights falling on their face. For you, it's coming from behind. That's why
that's right, sir.
It makes it more dark. So
I don't know. I'll probably try it for the final one, or do you want to try this today?
Just see it off.
Okay. I can work with Sundar to finalize the lighting.
Got some more time. Yeah.
I don't want to waste your time, sir.
Yeah, sure. I understand. Okay. So what we will do, so let me explain this. So this is a thing called a StreamYard. Okay. So this is a platform, very, very nice. So you can see clarity is very, very good. And once we start the program, of course, Sundar and Cynthia will go off. So we will be there. So we'll have kind of half the screen will be mine and half the screen will be yours. So that's the first thing. Then second thing about StreamYard is that it can go simultaneously live on Facebook and YouTube. And it can do more than one Facebook and more than one YouTube. So I think, if I'm not wrong, Sundar, will be doing both the DMDSC Facebook plus
and your
Dr.V Mohan Facebook plus YouTube will be what? One or two?
Two YouTube.
Two YouTube. So four. So there'll be two simultaneously. What you're talking will go live on two Facebooks and two YouTubes. Okay.
Sure.
Now, just for your information, of course, these numbers don't translate into actual people watching. But just for your information, we have got more than 100,000 followers on the DMDSC Facebook channel.
Sure.
We've lost a lack of patience. This is the hospital one. My own is about 15,000 people. So that is separate. YouTube hospital doesn't have much. It's 1,000 something. And but my own is about 19,000 because I have all my videos there. So about 19,000. So put together, we're talking about 1.4 lakh kind of followers. But that doesn't translate.
That's almost intimidating.
No, but don't worry, it won't be. All of them are not going to watch. All of them may not even. I wish it was so. But Google a lot of tricks they play. They will not put, even if you have followers, they don't even send it to all those followers. They want to make money by making you pay, boost this. They're all about money making only. So anyway, these are numbers, and we will of course be putting it on we put the first one, Cynthia. Already it's gone, or?
Yes, sir.
It's already gone, no?
Yes, sir. It is being marketed.
Yeah. So let the month change. So tomorrow it becomes September. So I'll also put it in my channels, and the hospital channels have already started coming. So this is on Friday. So today we are on Monday. So from Tuesday on, from tomorrow we will start. Tuesday, Wednesday, Thursday, Friday. 4 times we'll put. You can also put in your whatever channels, Hinduja, whichever, Facebook, YouTube, whatever it is, you can put. That same thing you can put it there. So let more people see that. And so that is the first part for the getting the viewers kind of a thing.
Generally, how many viewers do you get in this kind of a chat?
It varies. It depends on the day. It depends on the time. It depends on the thing. So I find that weekends are better. Friday, Saturday, Sunday is actually better than a thing. And then the little later, if you have it, it's better. So now I made it 7 p.m. Earlier I used to do it 6 p.m. But the number can vary anything between 100 and at and people watching all the time. I mean, because this can go on for half an hour, 45 minutes, up to 1 hour also. So at any given, at any given time, people will be coming, going. That will be there. But people are continuously watching. The number varies anything between 100 to 300.
Okay? My God, so many.
Yeah, 100 to 300. I think 100 minimum will be there. So 100 to 300 people. There'll be also people asking questions. They'll ask the chat box. See, we have a chat box at the side. So, for example, now if I in the private chat box, if I type now, if I just type Ashish, it will come. So it has come there. Can you see it on your screen?
Yes, sir. Yes, sir.
So if you type also something, it'll come. But then this is a private chat. This is only between us. But if there is some question which people are asking, tell us more about something we'll ask. So Cynthia will probably be there typing it out for us, and it will come on the screen. So we can choose whether to take those questions or not. And if there are questions which you should take, sometimes it'll be just, it's very nice, keep up the good work, it's very nice to be on the thing. Some will take the advantage of having free consultation with me. My blood sugar is 300 now. Apply me 2 milligram. What should I do, doctor? That we can't help it. So for them, it's an opportunity to get me on the line. So I'll discuss those questions, or I'll say write to me or something like that. I'll say, and then I won't have consultations going on when this is there. But then there could be other such questions come up. But the good point for this is that once the show is over and we sign off, it doesn't go away. So whatever we have recorded will be there in YouTube, it will be there in Facebook forever. So that is when people really start. Excuse me. So I'll just finish the call I'm doing now. I'll call you back. After the thing is over, that's when people really start watching it, and then the numbers can go up. For example, when I did with the Jazz Sethi, the type 1 patient from Ahmedabad, Kiran Sethi, Geet Sethi's daughter, she's a filial daughter. So when I did the show with her, I had only about 150, 140 people. But ultimately, about almost 80,000 people have viewed it till now. So subsequently, the numbers went up, over the next week, became very, very, very popular. And so a lot of people saw it. And many of my others have also been quite popular. So this is a good channel. And what we get live is one thing, but most important is that it gets automatically stored. And so people keep looking, they will find it. And for you also it will be there, and for us also it will be there. So that is about the program, how it goes. So now I will start off by introducing you. And first I'll introduce you and say you're the Program Director of Health at Hinduja Foundation. He leads the health initiatives of this, deals with type 1 resistant drug-resistant TB, cancer, previously worked with Clinton Foundation. We'll give you a brief intro to that, alumnus of Armed Medical College and all that. Then we'll start talking about certain things, and I have not actually written down what I'm going to do. I'll do that probably by the last day. But obviously, I'll ask you about, first of all, about yourself. So you can say about your previous thing. I'll probably ask you, what did you do with the Clinton Foundation? What kind of work did you do? And Army Medical Corp. We'll probably avoid the Indian Army. We'll talk about Clinton Foundation. Then we'll talk about your prize, the Global Hult Prize for Nanohealth. Then we'll talk about Nanohealth. Then we'll talk about Clinton Foundation. Then we'll come to Hinduja. How long have you been with Hinduja? And what are your main projects? Then you can talk about type 1, this. Then we'll start about type 1. We'll say, great that you're doing type 1. Tell us about this project, which we are also involved in. So you can say 3 centers, this, that, roughly how many children are getting free treatment under this, benefits. And then we can share, I'll ask you from your side, what has been your, satisfying moment for this project. You can talk about whatever you need. We can do that. I know you have typed some. Yeah.
These are the questions that I had thought also, sir.
Okay. So tell us a little about. And take a picture
we could focus more on the Hinduja and less on me, because it's a good opportunity to speak about the foundation and its work.
Yeah. Wonderful. We'll do that. Okay. So we'll tell a little about Hinduja Foundation, Hinduja Group. What are the different initiatives? Yeah. Tell us about type 1 diabetes. Correct. What has been most heartening feature program? How has COVID impacted the program? Yeah. What do you see the role of private philanthropy charity driving public health in India near future? Okay. So wonderful. We already have about 6 things, and each thing will take 2-3 minutes. Already you've gone for half an hour. And then, of course, questions will keep coming up. So once some questions come up, that will divert a little bit and it will go. Some may be directly related to me and not to this topic at all. Some of them may be obliged to take. So I might go off the tangent a little bit and say, let's digress a little bit now about this particular. For example, someone with type 1 will come and say, when is a cure for diabetes coming? You can't ignore that, So I'll say, okay, something about this, something we'll keep talking. Then we'll come back to the topic. So it will be a free-flowing discussion. no big agenda, but these are useful because unless we have some definite things to start, we'll be stuck in the beginning itself, not knowing what to do. Once you're kind of gone through the first 20 minutes, half an hour, then it's easy, and then you can also ask me some questions. And then in the end or at any time, you can say how about MDRF and how what your experience has been and what your thing is and how we can help more people. Like that, it'll be more a general kind of a thing. How people will die if you don't give them insulin, And some of the stories of Cynthia and Sundar, you can pick up some of these stories from the Hinduja Foundation supported people itself from Tangamani. She has many of these stories. Even from the report that they have sent them, it is there. Some people who have got, pump, they have got AGP, they have got, the A1Cs have come down. We even have the report, the last report where I presented, my slides will be there. The A1C came down by 1.5%, 2%, and each A1C 1% reduction improves, prevents complications by 25% or whatever. These are the kind of things which the real impact of the support, So that part we will talk about. If there is anything which you don't want us to discuss about also, you can say we won't go there at all. Okay. So
during the chat, you mean?
During the live chat. If there is something, for example, we won't discuss how much the project costs and how much Hinduja spent on this or those kind of things and all we'll avoid related to money and how much unless you want to talk about that. I don't know.
No.
Better
Even
not to public forum. Better not to bring that up.
Because it will go on record and somebody's going to talk about it later.
Somebody right from income tax to we don't know who all are listening and what it is. So we'll make it more like a public benefit thing. We are doing a charity. We are benefiting people. Emotionally, people are getting benefited. Health-wise, promotion of health is occurring. This is what I think we'll have to do.
Is the important part. So that's the idea. So we're trying to build awareness.
Yeah.
This is one more angle to build awareness about type 1 diabetes. Let's not go into anything political.
Yeah. That's true. We shouldn't get into any of it.
So what I was thinking about in terms of the heartening feature of the program, sir, is the feature of patients helping each other. How patients are step up and say, okay, let's pay it forward. Let's get the other people, because living with type 1 diabetes is by itself quite a challenge outside of insulin itself. So especially some of the patients who are coming in your speaking to the children right now over the period of time. There are people who are fairly well-to-do as motivational speakers. They come, so maybe we could speak on that. In terms of COVID, sir, I'll tell you the experience that has been with Mumbai, Pune, and Chennai has been very different. So Pune has gone on almost non-stop because patients have been able to access. The police has been very.
Because I think their COVID came very late. No, only I think July or something. Only their COVID really hit Pune. Until then, it was all Mumbai. Pune was only late start only now. Now probably they'll get. I don't know.
No, also police in Pune. No, whenever you show the iCard of okay, I'm a type 1 patient going for this medicine, the police were more liberal. In Mumbai, they were not so. And Mumbai, the panic was also a little higher.
Yeah.
So I could actually make that distinction between different parts of the country. Do you think it's useful?
Yeah. We can do that. Yeah.
Okay.
And we can make the point that anybody who has a medical problem should not be stopped on any ground because it's a life and death issue. Suppose they don't get to hospital, they can go to ketoacidosis and all that. So we must avoid that totally. That part I think is well taken. So. And from Chennai's point of view, there were interruptions, but now it is again beginning to, because we had all mixed signals. Even across the country, if you see, the Telangana government, for example, said doesn't involve a project, but I'm just saying the Telangana government said that if private practitioners see routine cases, it means anything routine other than an emergency, other than a COVID, they'll be arrested. All clinics have to close down. Everybody stays at home. It's a lockdown. nobody should look at nobody should even see patients. That was the thing. Now the Mumbai government actually did the opposite. They said if you don't go to work, if a doctor doesn't go to work, we will take away medicines and all that. That way it came. Okay. In Chennai, they were keeping quiet. They were neither saying this nor saying that. So at one point, I contacted a health minister and the health secretary and all that and told them, look, we are treating diabetes. And every day in the assembly, you are saying that among the deaths, the worst cases and the worst results are in people with diabetes. Okay. If you don't allow us to look after a diabetic patient, your death rates are going to go up. So we are going to do routine diabetes care only. We are not going to do COVID at all. But allow us to do it because that is very important. And so they took the point, and through our association also we wrote to them. Through RSSDA we wrote to them. So the minister said, "Okay, point well taken. You continue with what you're doing." I said, "This is what we should be doing: control diabetes so that the risk factors come down. And if you get COVID, you don't do so badly." So they took that point. So in different places, different timings. See, initially in Karnataka they said you should not open the clinics. Then what happened? One of the chief ministers, some relatives, could not get access to healthcare, and there was a big ruckus. So he said, "No, all doctors have to go to work and start seeing patients." It's all driven by people, individual needs, individual thing, and all that. But
so actually,
overall,
it's a very
yeah.
What you're saying, sir, is actually very illuminating. Maybe this is a question that I should ask you in this chat, and there'll be a lot of people who will be interested in this. Almost a national level picture of different
Correct.
inputs that clinicians are getting.
There was one cardiologist in Delhi who was stopped. He had to cross the border and go to Noida, and they said it's a different state. It's
interstate.
A different interstate. You cannot go. He said, I live here, but my practice is there. They said, no, you cannot go. It's not. He said, I've got procedures to do, and I'm practicing on the other side. They said, no, you cannot do. See, one country divided as if it is, but some different country or enemy territory or something like that, So, and all this question of e-passes and all that, only now the Modi government has announced 2 days ago, no more e-passes. Even now, Tamil Nadu government is saying that they had inter-district. So, for example, Chennai, Tambaram is actually outside Chennai. So, one of the branches outside. So, suppose somebody has to go from here to our branch, they cannot go. It's giving another district. You need an e-pass for that. So, that ridiculous extent it is going. And now also, the Tamil Nadu government has said yesterday, they've said that the e-passes are not needed within the district of Tamil Nadu, but anybody coming from another state or from another country needs an e-pass. But it's very easy. Just give your Aadhaar card number and we'll give it to you immediately, they're saying.
Then why do it?
That's what. And Modi has specifically said, no, within the country, there's nothing. Somebody coming from abroad, and coming from abroad, you already got passport. Then why do you need an e-pass to enter? Doesn't make sense. And that was so late, after 6 months. Now we are talking about e-passes and all that, when countries have opened up and everything has gone back to normal. So sometimes they don't know what to do. They're confused and they really don't know what to do. They are afraid that the opposition will ask them why so many cases, why so many died, why so many things. This is constantly the opposition is kind of harassing them. So
I think we've done a very good job as a country to control COVID. I mean, it's not.
Absolutely. No doubt about it. So far, we have done well. But from now on, the economic situation will be the rider now. Because I think now if you start seeing about, now is not the time for lockdown and this, that's all over. The phase is over long. We locked down very early. And maybe that's why for many months we kept saying India, no cases, no deaths, no this thing. Then finally, of course, the cases started going up. Today we have one of the highest, and we kind of delayed it. Slowly we delayed it, and then we did it, which is probably good for the country. It was very good. Otherwise, we would have been overburdened with a lot of cases even 3 months, 4 months ago. But from now on, things have to change. We have to get back to normal now. This economy will be totally gone.
And even health infrastructure. So I've been involved very closely in Mumbai. So we've seen that there's been substantial increase in the health infrastructure for COVID. So at least we're a little more prepared for another spike of cases.
Correct.
So, I think so far so good. Let's see how things go. Sir.
Yeah. Good.
So back to the chat, sir. Back to the chat. Any other point you wanted to speak? Maybe you wanted to speak about the private philanthropy or charity.
Yes, we'll talk about that. And so how do we address that?
So what I was looking at was that now the COVID situation has thrown very good spotlight on public health uh, as an important challenge for us as a society, and now there's so much more focus on improving infrastructure, improving health systems, uh, health skilling, both at the doctor level and at the paramedic level. We at the foundation, sir, also recently become part of an alliance of a few corporate houses trying to upgrade, the health upgrade the skills of healthcare workers, and we see that there's a lot more required in terms of investments in public building health systems and health infrastructure for the country, and that way that has been the silver lining of COVID. It is told us that we are um, you know we were falling short, and here's a chance for us to make amends and improve.
Okay. Yeah,
That's
in fact, to be very honest, even though I'm in the
right.
private sector, I think the government has done a better job of handling COVID than private overall, because government hospitals are free, and also they quickly ramped up their COVID infrastructure everywhere. And I can't say it's the best, but they've really done a good job. Whereas a lot of private people could not handle the COVID cases. Of course, many did well. Many of they made it, exclusive COVID hospitals. They made it in the private sector. Of course, the facilities and all are better, so that way they were good. But many could not handle, and they simply refer off in the last minute to the government, and then they didn't want deaths in their hospital and all that.
There was an analysis which I saw, which there was a comment which I saw, that the private sector, most of it is actually withdrawn during the phase of this pandemic.
Yeah,
And I think to a certain extent that was true. A lot of the private sector said, okay, we'll wait and watch, we'll see how things evolve. Then we'll
yeah.
probably come back to.
There
Whereas the
are
private.
many reasons for that also, because for example, today's paper I think said that nurses severe shortage in private hospitals, because many left and went away, and
Mhm.
so then they cannot run the infrastructure. Similarly, unlike the government, where there is some kind of answerability, you lose your job, you lose your thing. Private sector is not like that. Anybody can leave, anybody can come, private people can fire them, people can resign, they can go. Whereas government, you're answerable. So
Sure, sir.
therefore, they put on duties and they had to go. So otherwise,
Sure.
you lose your whole experience, and everything will go off. So that
Sure.
way, I think the government had certain advantages in doing that. Whereas private sector, smaller numbers, smaller thing, they could not handle that much.
And the other thing is probably is going to throw a spotlight. COVID is going to throw a spotlight on non-communicable diseases as well. Given
Yeah,
that diabetes is a high risk factor, I think
yeah,
it's now becoming
yeah,
more
very clear.
center
I
focus.
don't know whether you saw one of my articles in the Hindu that NCDs should not be sidelined by COVID. I'll send it to you. It's published about 2 weeks ago in the
Sure,
open page of the Hindu. So I
sure,
made a clear case saying that while COVID is very important, NCDs are also influenced by COVID, and you should not sideline them, because they
I
are the
saw it
thing. Ah,
on your Facebook this
I
time. So
understand.
I must have seen that.
Okay, right, right.
So, it's obviously now public. See, any which way, I think from a public health perspective, we were all first family planning, then TB/AIDS, malaria, and now we're gradually moving towards diabetes and hypertension as our focus areas.
Yeah,
That's from a national level policy perspective. And now with COVID, um, because you've seen that diabetes is one of the major risk factors, it's become so much more important to have a diabetes program, which is more
yeah, true, true.
effective.
Correct. Yeah.
So,
Anything else? Hinduja Foundation, Hinduja Group. Then type 1 diabetes also a little bit more. We'll talk about it. Some of the
sure.
challenges faced by by type 1 and why they need help, and how different groups, self-help groups and all have formed. And okay, so we'll take it like this. We'll see how it goes. It's not one agenda, so we have so many things, and we'll keep talking. If you find that you're slowing down in something, then you can ask something which will take off into another tangent. And then if I find something, then I'll bring in something. Meanwhile, I hope some questions come up. Then we'll take up that also. Suppose somebody asks, can we apply to the foundation directly for support or something? I don't know how you handle that, because we're going public with this. How do I also want to be included in this program and all? If somebody says I'm poor, I have to be included, how do you handle that?
So in terms of policy, what we are working with our 3 partners. It's Chennai, Pune, and Mumbai, and we encourage patients to apply to these programs if it fits
through one of these
recruitment criteria. We'll be happy to help. Otherwise, we could actually, if it's not a diabetes kind of a query, if it's something else, then we could look at it on a case-by-case basis. They could write to the program.
Yeah, so they might ask who to write to and all that, so maybe we'll yeah. So I think it's a good idea, Sundar, to give a email ID at the end. We've never done it earlier. We can give Ashish's email ID and my email ID. If anybody wants to write, you can write to that. How do you put it up? In the end, can you put it up? Or?
Yes, sir. We can put it at the end as a slide.
Remember, it's not only during the program. When it's recorded, also somebody will be watching. And that time, they won't be able to ask us. But they'll say, how do we contact these guys? So we'll say, these are the 2 email IDs you can contact. So we can give 2 email IDs. That may be a good idea.
Yes, sir.
In the end, before we close, you can put it up.
Yes, sir.
As a slide or something?
I'll create it now.
Okay. Just email ID will do, not a telephone number. Just email ID will do.
Yes, sir.
Yes. And maybe we'll give both our websites also. We can give.
Yes, sir.
Their website and our website, and their email ID and our email ID. That's it. They want more information, they can go to the website and have a look.
Perfect, sir. Yeah. Sir, also, did you find any case of Modi in our T1D cohort? We did some testing on Modi.
Yeah, it's all got kind of stopped because of COVID, because our restrictions are closed down in March. Only on, when did we open? First of August, no? 1st of August, MDRF opened. So only last 30 days there, because we thought research is not so essential out of, people coming in, and they wanted less people to come in and all, number one. Number two is protection of the staff, What if they all fall sick and they think so? Hospital, we insisted that they come. Even that only half of the people came. Half of the patients came, half of the doctors came. But research staff, we said, you just stay away at home. You want work and all that. The labs and everything started again in August. So we'll see how it goes.
So what about, do you want to speak about insulin pumps for people with brittle diabetes?
Yeah, we'll talk about it. That we'll talk about, yeah. Where it is indicated or something, huh? Yeah.
Also, the need for awareness. I'm very fond of that story you said, sir, about bits pilani.
Yeah. That girl who went and had hypos and
A good story to tell. Good story to tell why awareness and why such kind of programs are useful. Also, you spoke about those 2 Muslim girls who came from far away.
And they had multiple people in the same family. That one is it? Three in a row. First one, the 3 girls, and the first one I said that they'll never get. Second one will not get, and they got it. And then when they got the third child, they said, will this one get it? I said, 100% they will not get it. And they got it. Third, all the three girls, all the three are type 1. So that's from OT, that family from OT, Muslim family, yeah.
Are they part of this program, our program?
No. They can kind of afford. So they are managing on their own. So.
No, there's specifically somebody you mentioned, sir, who heard about us and they didn't even have money for bus fare. They borrowed money for bus fare and came.
The stories from Tangamani you get, Cynthia. We've already given them those stories, and then some of them even spoken and all that. The photographs are there, and then videos are there. So that we'll talk about. Some human interest stories are very good. Yeah, you're right.
Sure.
We'll take up at least 2 or 3 of these human interest stories, and we'll ask them whether they they are willing for us to talk about it in a program, because some of them have said put it on YouTube and all, and they have themselves come and spoken about it. So I'll talk to Tangamani.
And so why this might be useful, sir, is to anybody who's watching about type 1 diabetes, this kind of a program, they'll realize that, okay, this can be devastating for some people.
Yeah.
And so we don't need to necessarily name them or tell them or identify it.
Yeah. Oh, you made it. Okay. Email it, Mohan, Ashish, website. Okay. That's good. HindujaGroup.com. www is needed. You need
Hinduja Foundation.org.
Hinduja Foundation. Change it.
Okay, I'll change it.
Yeah. Hinduja Foundation.org. Org.
Diabetes microsite along with our website. Remember, this was our earlier idea. Then Dheeraj sir wanted a e-newsletter. So
yeah.
This newsletter. Now we're going back to the microsite.
Yeah.
Now we've got all those videos and all. Also, we could put it up there.
So that's the one. If they click on that, they should get. So that is what I wanted you also to write in a blog also, no, for our website. After this, what we do about 1,500 words about how charity can help, and there you can cover about this, how it can be devastating and why they need support, and in what all ways they can support. And then you can give the link to the T1D1 project. Say the 3 centers are doing this. So many patients have been enrolled in these 3 patients, and 1 or 2 examples of one story, like this child had this, and then how this project helped this or something like that. And so about the T1D1 project itself, you can write, because
I'll do that, sir.
So yeah, 1 page.
Give me a few days, sir. Just now we've closed actually a new grant, sir. We've committed one with the Chopra Foundation. I was telling you, no, sir. So now we're going to do. Now we've given a green light to working in. Just like a T1D program, we now have a depression and suicide prevention program.
Fantastic. Very, very good.
And,
much.
So,
COVID, you can imagine.
So I was actually pushing for more of a de-addiction program.
Okay.
I think that's from a service provision. No country needs that more. We have a lot of resources for suicide prevention, but this one will also be useful because now mental health cases are even increasing so much more.
COVID, COVID has pushed so many people into the brink, and suicides have gone up so much, depression. Now it's going to get worse because next year, with the once the COVID thing the disease part of it settles down, then the harsh reality. Now people are scared only about being alive and dying, that's what they're scared of. Next year, what will happen? Many institutions will close down because they could not survive.
Of course.
Huge economic recession, and so people will lose jobs. They won't have this. They won't have that. So the real impact is going to come in 2021, and then 2022. I think we will recover. 2021 is going to be a bad year from the. Maybe the COVID itself will not be there, but the effect of COVID will definitely be felt. It's not going to just spring back like that in, coming 1st April, we are all okay. It's not going to happen. So many people have been without work for so long that Hinduja Foundation.org, correct. Dr.Mohan's.com, right.
No, I agree with you, sir. Our primary interventions in COVID has been food security.
Okay.
We have helped with food security in so many different places across the country, including in Chennai. So in that medical college right opposite the railway station, no sir? Stanley.
Yeah.
So we've been distributing food daily for the ever since the
that is across the railway station is Madras Medical College, General Hospital. Government. This is my alma mater. Central Station, opposite Central. No, the two big. That's GH.
So I think either Stanley or MMC, we are doing a lot of food distribution.
Stanley is in North Madras.
Okay, sir.
This is in the just bang opposite the railway station. Railway station is General.
Sir. I've been in Chennai for some time.
Okay.
Yeah. Oh, you didn't know this, sir. I worked with the TV program in Chennai, sir.
Oh, yeah, correct.
Yeah. So with the Clinton Foundation, I was just like I'm a program manager here, sir. Okay. I was doing program management for
the Clinton Foundation was at TV, is it? Okay.
Yes, sir. In TV, I was working with the district TV officer, and Ripon Building was where DC Health sits now. So that's where we used to keep going.
Okay. Yeah, that's near the Central Station only. Yeah.
Sure. Okay. And Chetpet, you must be knowing, no? NIRT, sir?
Yeah, of course.
TB Research Center.
Yeah.
So that was one of our major partners.
We are called TRC. Yeah. I used to go there.
Sure.
Very, very good.
Sure. So I think we have a decent amount to speak about.
We'll make some, bring it into some kind of an order, and then we'll start the flow. I'll start a little bit about yourself. We can be brief. Who you are, it's also important. Then we'll get into Hinduja, and then the foundation, then T1D1 project, T1D project. Then from there we'll keep going. I think we'll bring in little COVID here, there, and like that we'll go. And we got all these to start with also.
So. Sure. I think it's the same format as you're saying.
Yeah.
We'll just add about me a little bit.
Yeah. Okay.
Perfect, sir.
Wonderful. Anything else?
I think we are good, sir.
Cynthia.
Yes, sir. Fine.
Okay. So there'll be another link which he'll send. Sundar will send another link. And one more session dry run with him separately you have for the lighting part alone. Because the lighting, I'm not happy with your lighting. Something you have to do about that.
Sure, sir. So that I'll work with Sundar, sir.
Yeah. It's mostly the change of angle. Last time also for somebody like this we did. Then that person changed the thing and it became really good.
I'll just change it.
I'll
change it now only, sir.
It's gone. Completely. So that's all.
I'll change it now only, sir.
Okay. Good. Thank you. Then I'll quit. Sir. Okay. Yeah.
Okay.
Bye.
Thank you so much, sir. Good evening, sir.
See you on Friday.
Right. Sundar, please tell me if.
Yes, sir. We are there to help you.
I can shift my entire study.
Take it.
No?
No, sir. It's dark. Still dark.
Still dark. Let's see if I can there in this room. Better? No.
Better than the previous one, sir, but still dark only. Sir, slightly.
If light falls on your face.
This seems to be slightly better. It's not so.
I'm living in a dark house now. I know.
No, not like that, sir. Actually, you can try to put some lamp or something like that in front of you. It'll be good. Some emergency lamp or something like that.
I'll look for one. Is this not good?
Sir, this is much better than the previous one.
Okay. But the background is not good. Is that all right?
That's okay, I believe, sir. You can put a screen or something like that.
Okay. Just give me 1 minute.
That should be fine, sir.
Just give me 1 minute. I'll just take the chair and see how it is. 1 minute.
Yeah. Doctor, in the live stop panilama.